Most of us think about antidepressants in one main way. Do they help how someone feels? I'm a psychiatrist, and in this video, I will talk about recent evidence on a more curious question. What else happens in the body when someone takes antidepressants? Not in a dramatic headline grabbing way, just what's going on under the surface. Researchers have looked beyond mood and focused on how antidepressants affect the body, such as weight and heart health. To answer that, they stepped back and combined data from a large number of clinical trials and regulatory reports involving tens of thousands of people and around 30 commonly prescribed antidepressant medications. This kind of research allows scientists to see patterns that individual studies simply can't. One of the clearest messages was this: antidepressants don't all behave the same way in the body. Within the first couple of months of treatment, some antidepressant medications were associated on average with slight weight gain, while others were linked with slight weight loss. Some tended to increase heart rate a little, others reduced it. Blood pressure shifted subtly in different directions depending on the type of medication. Now, these weren't dramatic changes, and they didn't happen to everyone, but they were consistent enough across large groups to be measurable. What made the findings even more interesting was that the person taking the medication mattered. When researchers looked across the studies, they found that the body weight was associated with how antidepressants affected individual heart-related and liver-related measures, while the age of the individual was linked to differences in metabolic changes like blood sugar and cholesterol. In other words, the same medication can behave differently depending on who's taking it, what their metabolism is like, what their heart and liver is like. Then there is a deeper question. Why are some antidepressants more strongly linked to weight gain than others? The answer lies in how these medications interact with receptors in the brain and body, or systems involved not just in mood, but in appetite and satiety. Evidence suggests that weight gain was most evident with antidepressants that block certain receptors, particularly histamine and serotonin receptors. You don't need to remember these names. What matters is what they do. These receptors help regulate hunger and fullness, and when they are blocked, appetite can increase or satiety can decrease in some people over time. Again, remember, this effect does not happen to everyone. What's important is how carefully the researchers interpret this. The study does not suggest that antidepressants are unsafe, it does not say people shouldn't take them, and it doesn't claim these effects happen to everyone. Many people benefit enormously from antidepressants, sometimes in life-saving ways, and this research doesn't change that. Instead, it just adds context. It helps explain why experiences vary and why choosing an antidepressant isn't just about treating a diagnosis, but about treating a whole person, including their physical health priorities and risk factors. It's also important to be honest about the limits of research, because this kind of analysis looks at averages across thousands of people. It can't predict what will happen to any one individual. That's how science works. Knowledge evolves over time, with each study adding another piece rather than delivering a final answer. If you are taking antidepressants and they are helping you, this study isn't a reason to worry or to stop treatment. But it is a reminder that it is okay to ask thoughtful questions about how a medication affects your whole body, not just your mood, and to have those conversations with your clinician. This information doesn't change the story of antidepressants. It deepens it. It reminds us that the brain doesn't live in isolation from the body. And the best mental health care is not one size fits all, but carefully tailored, informed, and compassionate. Please subscribe to my channel if you've enjoyed today's video. The more subscribers I have, the more YouTube gives me the ability to make more creative videos. Like it, share it, tell it. Tell it to all the people you know. And thank you for watching.